Thank you for joining us today to talk about a topic that I know is top of mind for us here at Maven and for many of you as well, the current state of reproductive care in the US and how you can improve access to care for your employees in times of increased uncertainty. We will have some time for questions at the end you have into the Q&A at the bottom of your Zoom screen. We hope that you come away from this conversation prepared and inspired to tackle the new year head on. So without further ado, let's dive in. My name is Kate Ryder, and I'm the Chief People Officer here at Maven. I joined Maven in 2022 and was drawn to Maven's mission of building a healthcare system that works for everyone. And I'm committed to doing that internally in my role here at Maven. And I'm thrilled to introduce our special guest today, Kate Ryder, the CEO and founder of Maven. Kate started Maven in 2014 after seeing firsthand how the lack of access to care impacted those starting families and returning to work as new parents. And she has been innovating on behalf of women and families ever since. Hi, Kate.
Hi.
Great. And then we're also joined by Dr. Danielle Dang, Maven's Senior Medical Director. She joined us here at Maven in 2023, and she spent her career working with vulnerable populations and underserved communities. Hi, Danielle.
Hello, everybody.
Okay, so before we dive into the content today, I'd like to take a minute to introduce Maven. Maven is the world's largest virtual clinic for women and families on a mission to make healthcare work for all of us. At Maven, we provide clinical, emotional, and financial support in one place through our always-on platform that's available 24/7, 365 days a year across the globe to support members when and where they need it. We offer compassionate care at some of the most joyful and at the most vulnerable stages of life, including fertility and family building, newborn care and maternity care, parenting and pediatrics, and menopause and ongoing care. We're focused on connecting our members to comprehensive women's and family healthcare at every step of their journey and addressing existing gaps and disparities in our traditional healthcare system. We're unique in our market because we are the only platform and company that has built end-to-end technology versus cobbling together a series of point solutions, which I know can be frustrating for members to navigate. We are mission-driven and we are leading with product. So to get the conversation started today, we would love to hear from all of you. We're going to put a poll up on the screen, and the question is, what is your biggest focus area around women's and family healthcare for your employees this year? So you can see a list of options and go ahead and click all that apply and let us know what your focus areas are. Okay, great. Why don't we close the poll and talk through the results? Okay, so I'll just speak through the results quickly. It looks like the top kind of ranking one was really around employee awareness of women's and family health benefits. So that's definitely something that's top of mind for all of you. Followed closely by two others, balancing employees' care with containing costs, and then also ensuring access to high quality care for all employees. Those seem to be the things that are top of mind for this group and things that we will definitely touch on here today. So thank you all for sharing your insights. It'll help inform our conversation. I'm going to pass it over to Kate Ryder, who will talk us through the current state of women's and family health for our US-based employees. Over to you, Kate.
Thanks. And thank you to everybody for being here and taking time out of your day. So hi, everybody. I'm so glad to be talking about this topic right now. It's more top of mind, I think, than ever for not just Maven, of course, but so many of our clients and partners. 10 years ago when I founded Maven, women's and family health was systematically underserved, underestimated, underfunded. And you know, one of the things that when you do something for 10 years, it's you kind of do this look back and you say, okay, have we made progress? Where have we improved and where are there still challenges? And so, you know, there's definitely some progress. And I think fertility coverage and menopause care are two notable areas. There have been amazing advancements in diagnostics, at-home fertility testing kits, cancer screenings, postpartum depression drug development. You know, same-sex couples are now finally included in eligibility for basic IVF and surrogacy coverage. And, you know, new virtual first models to support women in menopause are emerging, in menopause and midlife care, Maven's included. And so, you know, as I kind of look at even so many of our own employees in their 20s. Like the options they have today are so much better than the options that they had 10 years ago. However, healthcare for many women at the same time is worse today than it was 10 years ago. So there's a massive divide in where this access is being applied. And so 2.3 million women of reproductive age don't have access to the care that they need before, during, and after their pregnancy. And 1 in 3 US counties don't have a single OB-GYN. 36% of counties in the US are what we call maternity care deserts, meaning they have no obstetric hospitals, providers, or birth centers at all, nowhere for families to safely deliver a baby with trained guidance. And so this lack of medical support means safe pregnancies can quickly become unsafe, and high-risk pregnancies can quickly become life-threatening. And, really, when you do look at the data, it does support this. So over the last 2 decades, we've seen a 50% increase in maternal mortality rates. Findings from the CDC say that more than 80% of those pregnancy-related deaths are preventable. So that's always a statistic that really gets me, is just how many of these are preventable. So, I think also, of course, we're living in a post-Roe era. And so a lot of people still are waking up around the country, and they just don't know what care they have available today, what the care is going to be like when they go into the hospital. And so that too is just very stressful. And anyone who's ever gone on a fertility journey or been pregnant or given birth, you know that these life journeys are full of questions, and they're stressful enough without having to worry about whether your doctor is going to leave the state and whether you're going to get evidence-based care. So we're releasing our annual report next week, which is, why we do this annual webinar every year. And, we found that, and this is more than we've ever seen, 47% of employees, so 1 out of 2, who are expecting or considering having a child are more concerned about their reproductive health than in previous years. So again, just kind of take that in, as I look around Maven too, we have lots of expecting parents. We have lots of people thinking about having a baby. And it's just, it's crazy to think 1 out of 2 are holding this anxiety. And so when we throw people a lifeline during these moments of stress, I think the impact is really exponential.
Great. Thank you, Kate, for giving us this background. I think, especially for me, but I think for this audience, it really puts into scale the areas of opportunity for employers. So Danielle, we would love to get your perspective as well. And I just wanted to start with a question for you. So Danielle, what are the most pressing challenges you see in women's and family healthcare across the US today?
It's so funny, Kate, when I hear you talk about the current state of women's health, and I'm trying to apply this question of what are the challenges, I will say overall, the challenge of women's health is the state of current women's health right now. As a physician, I think it's really hard to distill down, but I do see 3 main areas. And one of the ones that you brought up is really impactful, and that's access. So in terms of access, we are just seeing significant disparities in access to care. So just being able to get into a doctor's appointment, particularly in these rural and underserved areas. Like you said, most counties in the US still lack this absolutely foundational element of OB-GYNs to deliver bread and butter maternity care. And that's not even talking about things like reproductive endocrinologists for fertility issues or maternal fetal medicine for high-risk members. And though virtual platforms like Maven, I think we are exceptionally well positioned to bridge these gaps, there's still this larger systemic challenge that needs to be done to address barriers. So things like broadband access and reimbursement policies to really think through how to build a scalable system for healthcare. You also touched on this, Kate. A big challenge for healthcare providers right now is going to be equity. The maternal health disparities are just staggering, particularly among Black and Indigenous communities. We're essentially in a crisis point right now. It's the maternal mortality is unacceptably high. 80% of maternal deaths are preventable. You said that, I'm going to say it again, because I think that should really hit people in the gut. People are dying and 80% of them don't need to. So tackling this again requires this larger systematic change, community engagement, inclusive care models, policies that address social determinants of health. These are all things that we solution for as a virtual platform as well. And I think the last one that wasn't mentioned is particularly relevant, and it's about provider burnout. this system that you've described, that I've touched on as well, it's just not set up to support community-based physicians in delivering the types of care that they want to their members by themselves. And it's absolutely not about bad doctors. Like, these are amazing physicians, but the pressures of being an OB-GYN or a women's health specialist in the community is just enormous. So from things like administrative burden to patient loads, navigating regulations, doctors are just under-resourced in a way that just like feeds into this provider burnout. And it's not just about like, oh, poor doctors, we're so tired. Like, this has real impact on the care that's delivered to our patients and our members as well. So I think having access to an entire network of providers that can support each other to meet members where they're at, to answer the million questions that just like can't be answered in a 10-minute visit, if you are in fact able to get that appointment with your doctor, I think that's what this is about, building medical engagement in a community that really supports the work of in-person care.
Thanks, Danielle. I'm going to ask one more follow-up question of just how, from your perspective, does reproductive health restrictions change the way that you approach care with your patients?
Also a loaded question. Thanks a lot, Kate. I think there are a lot of different ways to answer this. And I think just to continue to pull on this thread of provider burnout, I will speak for myself, and I think a majority of my fellow colleagues, that there is this profound sense of paranoia in the community. And it colors this moment, not only for me as a physician, but for all of us. And many of my physicians, my colleagues, we are sitting back and I'm just kind of watching as important public health data sets and treatment guidelines are being scrubbed from the internet. And state by state regulations that were already hard to navigate are becoming harder to navigate. And many of us feel kind of torn between delivering the best evidence-based care that we can and the ability to avoid scrutiny. So in some cases, it's so clear to me that this calculus, it just becomes too much. And providers decide to leave regions or practice altogether. And some states have lost nearly a quarter of their OB-GYN workforce in the most recent years. So I think ultimately what we're talking about here is this shared goal to meet members where they are, to meet patients where they are. We need to be able to empower them with information and continue providing this compassionate, this evidence-based care, even in shifting landscapes.
Okay. Thanks, Danielle, and thank you for tackling those tough questions. Now that we've spent some time talking through the statistics and the state of care in the US today, I want to take a few minutes to bring the situation to life through some real stories that have been shared with us. So I know Kate and Danielle, you both get the opportunity to meet with women around the country to discuss reproductive health care. Would love for you to share what you're learning in some of these conversations. And Kate, why don't we start with you?
Sure. Well, I'll share the maternal health one because I think fertility and menopause, those are happier, right? Because I think there's progress there and there's all this, gaps in care getting solved. However, it is kind of this twilight zone to feel like you hear these great stories of women finally getting HRT, and solving some of their symptoms of menopause, and they never had those solutions before. And the story that's top of mind to me on the state of maternal care and the juxtaposition is that one of our members was saying, who lives in Texas, and this is a member of a very senior leader at a company, and has all of the privileges and access in the world, was having her third child, had 2 other babies in Texas, over the last 6 years. And she was saying that her doctors, she has a code word with her doctors, because what she's concerned about is, what if she wakes up when she's 25 or 26 weeks pregnant and there's something wrong? That she was really scared that she would go in, and if she needed to get evidence-based care, and her doctor was really scared too, that like she wouldn't be able to get it. And so, but it's not, so the code word is like, is my brother's unwell, should I go visit my brother? And then, and if her doctor says yes, hopefully this moment never happens. But if her doctor says yes, then, she leaves the state to go get medical care if she has some kind of spontaneous bleeding at 25 weeks. And so that's just crazy to think that, There's just that we're living in 2025, and these are the types of things that very resourceful women and are going through as they're doing one of the most important things in their life, which is bringing a baby into the world.
Yeah.
Like, Kate, that's so like I'm like visceral about stories like that, because I think regardless of what somebody's insurance looks like or what their coverage is, just building a family in the best of circumstances is life-changing, and it's vulnerable and it's hard. So it's adding fuel to this fire of like, this is not the way it should be. I think I think about one of the most powerful stories. It actually comes from one of our own employees. She was 11 weeks pregnant and on a work trip to Los Angeles. She woke up to cramping and pain in the middle of the night. And a few hours later, around, I think it was like 3 a.m. Pacific time, she started bleeding. And she has a great OB-GYN in New York, but she is alone in California at 3 a.m. And there's no way that you're going to be able to access that provider at that time, no matter what system you're set up with. So at Maven, she was able to log on within an hour and speak to one of our OB-GYNs who was able to guide her on what to do next. And in that moment, she did not feel alone. She didn't have family, she didn't have her doctor, but with this virtual care modality at Maven, we could be there for her with her options and guidance at that point. And it's like, even in less extreme circumstances, when you get exactly the care that you need when you need it, I think it can be life-saving as well. I don't want to like color on the dramatic things here. So even like things like, we had this other member who was having this horrible time breastfeeding her second child. So her nearest in-network lactation consultant was 30 minutes away. It was a drive and it had to be in person. There were no virtual capabilities. Cool, 30 minutes, not too bad, but she also has a toddler who hates being in the car. So she can't find this way to feed her second child while also being able to take care of her first. And that's a position that like no mother wants to be in. And that's completely agnostic of rules and regulations. It's just the way that brick and mortar system has set up. So with Maven, this member was able to speak to a virtual on-demand lactation consultant immediately from the comfort of her home. We have hours beyond 5, so she didn't have to miss work to do this. And her toddler is happy not in a car. So even like in the landscape that we are in right now that is so fraught with difficulties and nuance, there is still something so pure about being able to find the right care that you need at the moment that you need it.
Thank you both for sharing these stories. I know we all have our own personal stories and lots of stories from our members and from our employees, and it's really powerful to hear them. I want to shift the conversation now into what we can do to make a difference for our employees, because as HR and benefits leaders, we're fortunate to be able to make an impact here. So, Kate, I know you talk with companies every day about bridging these gaps in care. What role do you see that employers play in building better women's and family health support for their employees? Would love to hear from you.
Sure. You know, I'm thinking this week I actually had lunch with one of our awesome clients, Stephanie Kramer, is the CHRO of L'Oreal. And it's just amazing, you know, when you meet leaders like her, you're like, wow, like, you know, benefits leaders and CHROs, like everyone was like her, the world would be such a good place, because you have such, that like leaders have such a tremendous ability to impact. And, you know, as I think about the last 10 years in healthcare, it's obviously a very complicated system. There's misaligned incentives. We all know this, but employers are like the white knights, where, you know, the majority of the US population gets their healthcare benefits through their companies, and companies just want people to get the right care. They want quality care. They want affordable care. And that just, you know, we do too. And so that just means it's just a joy to partner with just incredible leaders and incredible companies to truly make an impact here. And I think the really unique thing about our category in women's and family health is, you know, you look across healthcare and there's so much that needs to be done. We need a system with more preventative care. You know, you need to be able to book a doctor in time. You need to get the right information. It would be so nice to know how much you have to pay for things. And, you know, there's all sorts of things, but I think in our category, where this intersects so much with just such a personal and vulnerable and joyful journey, hopefully most of the time, that, you know, a benefit really can help. Because whereas in some other areas, you know, it's just, access is hard, but you can eventually find it. Like in our category, like access you can't get in your town in a bricks and mortar setting. Like you actually really need that you know, you can book a provider on Maven, a specific provider type, or get a level of culturally competent care in a highly specific and vulnerable stage. And so I think that there's so much. And so we work with over 2,000 of the world's largest companies. We work with half the Fortune 50. And what's just amazing is that we're genuinely not only kind of, you know, of course, delivering a great member experience. You know, we're all in one platform. We've been building a technology platform end to end for 10 years. So at this point, you know, it really can help follow the patient and support the patient through all of the nuances of the journeys, whether it's, you know, access to mental health care or prescriptions or care plans to manage a high-risk condition, or, you know, on the fertility side, we are the payer and the carve out, so we can design a best-in-class benefit. You know, but really, it's just amazing because we're also just truly changing lives in a way. Sometimes I'm like, wow, a little app in your pocket, a little clinic in your pocket can truly make such an impact. And we're seeing it and we're hearing it. And it's just, it's amazing to see, because there are just so many gaps in care in the first place in our category. And so access, this whole kind of notion of access, so it was the word when we started Maven 10 years ago. And I think as we think about going forward, it's still one of the biggest problems in healthcare. It is still so hard. The day-to-day, I was just talking to one of our employees, and her son just had this very specific surgery, and she actually had an amazing patient experience because it was like a very expensive surgery. And it was this coordinated care model in the surgical center, and everything was great. And she was kind of reflecting on, but I still can't get basic stuff in my day-to-day in healthcare. And so I think that that's really where these virtual care models can step in, like Maven, and it's what we see. And so we're fundamentally that digital platform. We're the largest telemedicine network in women's and family health. We are that platform that drives not only member engagement, and that's always how we build product, with the patient as our North Star. So as much as we love our clients and partners, sometimes if we get too many feature requests, we say, okay, but like you want us to make your members happy. And that's what we're really best at. So we're always prioritizing the member, which really then drives the outcomes that, you know, everyone's looking for, including the member. And so I think, you know, even just if people, one of the coolest things in technology right now, of course, is AI. And as that is kind of also transforming patient and member experiences in so many different products, that even if someone, you know, they don't have an immediate need to meet with a provider virtually, they, you know, are not immediately going through an IVF benefit, or that, you know, that they don't need any kind of reimbursement support. There's still so many things that we personalize through that journey, whether it's digital, you know, coaches or forums, community forums to meet other patients, whether it's reading content, but it's all just AI is making everything that much more personalized every month, every year. And so it's just so cool to really see journeys transform, because they're that much more targeted to specifically what you're looking for, when you need it, and then it really kind of drives the right outcome and the right experience. And so anyways, no matter what's happening in the world, I think particularly in women's and family health, like employers can really step up here and offer their workforce something that I think is obviously truly priceless during this time of life, which is peace of mind.
Great. And Danielle, I think I would love to hear from your viewpoint as a physician. What are the benefits of these virtual forms of care? How would you think about that?
Yeah, I think in addition to just virtual forms of care, I will say just offering a platform like Maven that is just so forward in thinking through what women and families need, and more importantly, what women and family needs to support people in the workplace, is just so indicative of the culture of a company. I will say, so personally, I had a 7-year family building journey. I had all the IVF, I had all the treatments. This spanned 3 workplaces. I'm a doctor, so it was all healthcare adjacent, very well resourced. Everything was covered. I did not have Maven, and I was so alone. I was never more vulnerable in my life because there wasn't this external signal for me to think that it was okay to talk about and to acknowledge that this is a part of who I am, and part of who I am shows up every single day in the workplace. So just thinking about it from that level, it's more than just like the app in the pocket. It's just, it's a signal that it's okay to be a woman and to have a family in the workplace as well. So aside from that, just the virtual cares, we have the feel-good part of it, but also we are showing improved outcomes. So digital healthcare has significant impact on outcomes. And for example, here at Maven, we actually see our care model lowering NICU admission rates. We are reducing unnecessary C-sections. We are reducing unnecessary ED utilization among our members. And of course, all of this leads to reduced costs as well. So Kate, you mentioned earlier that fertility and maternity are some of the biggest cost drivers for employees out there. And things like that we can impact, like C-sections, NICU rates, they significantly drive up the cost for employers and employees. And because we are able to manage a lot of these things through our digital care model, companies are able to lower costs holistically while still providing that exceptional care and that flag to employees that like, hey, we respect you as humans on a life journey here. As a specific example, I believe one of our Fortune 50 company clients saw a 17% reduction in total cost of care among members who met with one of our care advocates. That's staggering, and we've demonstrated that. I think the last thing that virtual care enables us to do is just have more closer touch points with high-risk members. So digital health, we've said it before, I'll probably say it again here, it's in your pocket, you have access to it. So people are able to access it more frequently, more organically in the process of their lives. And if you're thinking about high-risk pregnancies in general, the fact that these women can be supported 24/7 with curated care teams and on-demand access to care, I think really does a lot to mitigate risks.
So Kate mentioned other specialists beyond just OB-GYNs who can support during and beyond the pregnancy journey. Danielle, can you talk a little bit more about how other specialists can make a difference for employees?
Absolutely. And I think the phrase is it takes a village. And I know this because I now have a 2-year-old and he just turned 2 and it's like wild. And yes, it does take a village. It's not just about my OB-GYN or my pediatrician. On Maven, we also have doulas, and doulas provide this improved emotional support and patient advocacy. They support in the postpartum period to improve these outcomes. We have mental health specialists who help manage stress, anxiety, depression, postpartum depression in particular. There are midwives on the platform to support in prenatal care, nutrition education, supporting education on low intervention births. We even have career coaches to support women in kind of navigating the nuances of being pregnant, negotiating parental leave, understanding what that could look like for you in your career. And I think the best thing about this is that you do have that on-demand access. So even if you are like thinking through my journey, I was very fortunate to be resourced enough to have access to all of those resources in a brick and mortar setting. And the likelihood of me being able to actually access all of those in one place, to be able to block out 1 hour on my schedule, meet with an OB-GYN, then meet with a mental health specialist, then be able to meet with a doula in one place is impossible without a virtual model like Maven. So I think those are just some of the highlights of being able to deliver this care virtually.
Yeah, thank you both for sharing. I think the other big question here is how we as HR and benefits leaders really navigate the shifting state laws and staying compliant while ensuring our employees have the reproductive health support they need. So I know many of us as leaders are operating with tight budgets and small but mighty teams, and we don't necessarily have the bandwidth to be experts in all of the details on new regulations and hospital closures, and nor do we really want our employees not to be able to access the care because of where they live. So this is where I like to trust and rely on our benefits vendors, and this starts with choosing the right women's and family benefits partner just from the onset, and making sure that they have proven impact outcomes and they really drive ROI with clinically validated care models. And so we obviously have Maven available for our employees at Maven, but the questions I suggest when my peers ask, how do I understand this and what questions do I ask? Some of the questions I've suggested are really, is the company reducing NICU admissions? Is the company lowering C-section rates? And is the company reducing the number of employees who have to go to the emergency room during their pregnancy? I think the example you gave, Danielle, of being able to access Maven without having to go to the emergency room in the middle of the night is a great example. So overall, personalization is a key component, and so that's some of the key things that we look for when we're vetting benefits partners. And you want to see, do they have a one-size-fits-all model, or are they able to provide personalized care for every employee who joins? I think this This personalization can be really specific when looking at gaps in care, and any employee living in a maternity care desert, as Kate talked about at the beginning, and really navigating a high-risk pregnancy will likely have a very different kind of care need and profile than one who has a low-risk pregnancy living in a large city with more access. So we often talk about how you have to just kind of lift up the hood and really understand whether the company invests in R&D. Is it a true technology company? Do they deliver on personalization? Do they deliver on member experience? And there's a couple of tricks to how we do this. We kind of look to see, do they have engineering teams? Do they have product teams? You can look on LinkedIn and kind of see what the employee profile looks like and what the company is really about. Are they just great at marketing, or are they really a tech company? And you look at their financials and see whether you think they're going to sustain and be around for years. So all of those things are ideas in order to provide the best level of care for women and family benefits. I think for these companies, you have to really stay abreast of the state and federal laws and regulations. And I've seen it here at Maven. Our clients turn to us as experts in navigating the complexities of care for their employees so that we can hopefully take the burden off of their HR and benefits teams. So I know we've gone over a lot here, and we really want to get a sense from all of you on how you're thinking about navigating benefits as you look to the future. So before we get to the Q&A and the next steps of this, we wanted to just launch one more poll. And the question this time is, what changes would your organization consider making to your women's and family benefits in response to changing access to care? So I would love your input on kind of whether you would increase investment in different services like fertility, maternity, and parenting, or other things you see on the screen here. So take a minute and complete the poll, and we'll think through the results as a group. Okay, great. Why don't we go ahead and close the poll and look at the results for a minute? Okay. Kind of a mixed group here, and a pretty even split against all of the investments that were listed, and not seeing as much around travel, but also seeing some investment around mental health resources. So I think that's really interesting to think about as we think through kind of our benefits offerings. This is pretty in line with what we're seeing and what we're talking about too. So thank you for taking a minute to do that. So I want to make sure we have plenty of time for the questions at the end. But before we get to the Q&A, I'm going to give the floor back to Kate just one more time. Kate Ryder, do you have any last thoughts that you want to share with the audience here? Anything that you want to end on?
Sure. Honestly, just on a personal note, and Danielle, thank you so much for sharing your story. My story is similar. I have had not the 7-year journey, but just simply the multi-year journey to have 3 kids, 2 miscarriages, all supported by Maven. I genuinely was running to catch a plane once while talking to a pediatrician on Maven to make sure my son didn't have asthma. Thankfully, he didn't. And, you know, I think there's still a long road ahead of us, but we made huge amounts of progress. And I think it's always a good testament when the full team, including the founder, is just still constantly using the product, testing the product, and finding just deep support and, you know, value from the product. And so, anyway, so we're so thrilled. We love working with our clients. So many of them have such vision for how they want to do things, which is just so amazing. And we'd be excited to partner with you too.
Great. Okay, so thanks so much for that, Kate. And a huge thank you to you, Danielle, for all your insights on the call today. I know we have a couple of questions that we want to dig into, so let's save some time for that. And as a reminder, you can add any questions that you want to ask Danielle or Kate or myself in the Q&A window at the bottom of your Zoom screen. And it looks like we already have a few questions coming in through the Q&A that we can start with, and then we'll see how many we have time for. So here's a great question. Do employers offer Maven as an additional employee health benefit in addition to their traditional private health insurance benefits? Kate, I don't know if you want to jump in.
Sure, I can take that one. And then I think there's one before that too that Danielle could answer on just the relationship with the OB. But yes, employers do often offer Maven as an additional benefit. So either we can be the carve out for fertility, we are the payer in IVF, or you know, we do the wraparound support in maternity and parenting and menopause. We also work with most health plans. So you should just check with your health plan or you know, the Maven team. But you know, we work with almost all nationals, many regionals. So our level of coverage is pretty strong, which means it's a really seamless contracting process. And in some case, we are the health plan maternity program, and it's not white label or anything, but they've chosen Maven because I think one of the questions on here as well was, how do we gather data that employers saw a reduction in C-sections, claims, right? So we work with all the payers. They're constantly running claims analyses on us. We go through clinical product reviews with so many of these payers once a year. We do claims analyses with our clients. And so it's a pretty data-driven approach.
Great. Thank you. Okay, I'll go back up to that question. So Danielle, this probably is a great question for you. As Kate said, is the health information and kind of patient guidance care given by Maven healthcare providers communicated with the patients and employees, providers, like with the OB-GYN? Is there can be a continuous care in addressing a situation?
Absolutely. And I think the short answer to this is yes, right? But like in teasing through this, it's like thinking about how this virtual benefit integrates with somebody's in-person community care team. And I think about this in two aspects. The first one is like Maven, we are designed to complement, not replace in-person care. So there are always going to be aspects of healthcare like delivering a baby or like doing IVF that require this in-person treatment. And what we do is we really augment the ability to answer the patient's questions. So the way this information gets back to the member and then to the provider is through the patient. Like we fill this gap by providing personalized coaching, education, continuous support to these members between their standardized in-person visits. And from a provider perspective, as a physician myself, I love this because what this does is that it not only empowers these members to actually be participants in their own shared decision-making, but I know that if they've met with somebody at Maven, they are getting evidence-based advice. They have a knowledge base that did not come from Dr. TikTok or Dr. Instagram or social media. So it's really, we have after visit summaries that providers can show, that patients can show their providers. But I think the real magic of what we do is being able to spend time with members and educate them to be able to advocate for themselves.
Great. Here's a follow-up question maybe from the audience of just, can subscribers to Maven request care and guidance from the same provider? Like, can you actually select the same provider on an ongoing basis and have some say in that?
Yes, short answer. Absolutely.
Yes, I actually honestly have the same pediatrician, OB, and women's health physical therapist that I've been talking to for 7+ years.
Yeah. Okay, here's a good one around just kind of the population. So question from the audience is, men contribute up to 50% of fertility outcomes, but women are the ones who bear the burden of fertility challenges. So as family care platform for recognizing impact on women's health, how do you see the integration of male fertility into our care model? I don't know, Kate, if you want to start.
Yeah, I can, and Danielle can also add too, but I know, terrible that we have to bear the burden, right? But yes, we totally agree with you, and the clinical evidence is behind it. So we've actually had our male infertility offering integrated in our platform for years. One of the best ways is just a sperm analysis up front, when that's like one of the most missed opportunities when a couple is beginning IVF. Oftentimes it's just the woman tested and not the man. And so we have, we send at-home sperm kits to our members. So we have all of these capabilities built in. We have reproductive urologists on our platform. There's not that many in the country. And so we have a partner who gives us a great supply of reproductive urologists. And so, yeah, male fertility is definitely integral to our fertility care model.
Great. Okay, here's another great question. So maybe this one's for you, Kate. How do you see women's and family healthcare benefits changing as we look over the next 4 years? I know you started talking about AI a little bit, but I think this would be great for you to kind of chat through.
Listen, I think it's pretty straightforward, right? It's healthcare inflation is out of control right now. We know from our employer clients, costs are going up 5 to 10% a year. Next year, already preliminary reports are coming out. Costs are going to rise an additional 8%. And so, I think the women's and family health benefits just have to kind of hit the triple bottom line. Number one, they have to reduce costs because, as Danielle said, like fertility and maternity are two of the costliest areas in healthcare. And I know that was one of the answers that so many of you had in terms of how you're thinking about fertility and family benefits. Number two, have to actually expand access, because access is one of the core problems. And so it can't just be, oh, here's a few providers and you can maybe book one in 2 weeks. Like, it has to be a true virtual first clinic, where the access is as easy as it is to book a food delivery or Uber service, because that's what consumers want these days. And then number three, and this is where I think there's going to be just a massive separation between companies that are true technology platforms and companies that are not. The amount that you can do with personalization and AI to just make the products work better, which of course leads to better outcomes over the next 2 years, that's going to transform. And so it's going to be, you know, I guess like every single person on here, you should always be asking for live demos when you're looking at benefits, because then you'll just be able to see great, like which of these experiences feel like a rusty Cadillac, which of these experiences feel like, you know, the car of
Where it's going.
future that we
Yeah.
all deserve. So so that's I think that's going to transform not just women's and family health, but all benefits.
Great. Okay, here's another question on ROI. Maybe Danielle, you can kick this one off. The question is, how do you measure ROI when it comes to reproductive health benefits?
Yeah, I think that's a great question. I think we briefly touched on some of these points earlier, but we do demonstrate ROI for clients through several key metrics. And we do both look at clinical and business impact, because I don't want to overlook the things like enhanced productivity, reduced attrition, which are also very critical for employers. So in terms of maternity, it's a pretty straightforward measure of value. We have outcomes, we've said it before, lead to better patient experience and lower costs. So decreasing unnecessary C-sections, decreasing NICU reduction, decreasing prenatal birth or preterm birth, ED avoidance. All those things are pretty bread and butter that we're able to provide from a metrics component. And for fertility, it becomes a little bit more nuanced, because it's innate. When you offer a fertility benefit, you will add costs. But here, the way that Maven looks at it, it's really about managing that spend as well as possible. So through early stage fertility support and education, we do have the potential to actually reduce unnecessary IVF cycles, reduce that burden on women that came up earlier, and other high cost interventions. So we're not at all incentivized to push people towards certain treatment. And we're actually able to find that we help almost a third of our members get pregnant naturally.
Great. And then I think, you know, we have some more questions in here just around how Maven really integrates. So question, how does Maven integrate with in-person care? Danielle, I don't know if you want to kick that one off and just kind of give us an overview of how it works.
Yeah, I think I kind of answered that the first time with the ability to just support members in having the information that they need. So there is just we give everybody an after visit summary. They have access to all of the articles that we read, and we really empower our members to discuss this with their in-person care providers. I think the other part of this is, we said this earlier, there are certain parts that we cannot impact as a virtual provider. So if there is in-person care, and this is what people are looking for, Maven does provide curated lists of referrals to meet individual needs. And for things like fertility specifically, Maven's going to connect our members to a vetted network of fertility clinics all over the world, and support you with virtual care in between those appointments. And I think it's also important to say that this kind of goes beyond geography as well. We have a care matching process that considers individual lifestyles, religion, racial backgrounds, beliefs, all other aspects of your identity. And our team will work to connect you with providers who are trained to provide this type of whole person support.
Right. And then it looks like, Kate, you addressed 2 questions in the chat. Maybe we can just answer those out loud too. First question was, what was the global kind of services and presence? So getting an idea around the global presence. Do you want to share the answer with the group out loud?
Oh, sure. Just that we work with a lot of companies globally. We're in about 175 countries. We have translated services, local providers. So global is very, very much part of what we do and how we serve our employers who are multinationals.
Yeah. And then getting specific with California, there was a question of with the new California requirements to offer infertility care for groups larger than 100 employees, would adding Maven fulfill the requirement?
Yes, so that's obviously very top of mind for not only our California clients, but we're in conversations with so many to fulfill the requirement, depending on what type of organization you are, how big, whether you employ state employees. It depends on when things are going into effect. But just as an just as an example, like it's a $75,000 benefit in 2027, right? That you have to comply with if you're employing public sector employees. So Yes, Maven can help with that. And I think the most important thing there is, given the amount is quite substantial, you just want to make sure it's managed well. You want to make sure your patients are getting the highest quality care, they're getting the outcomes they deserve, and that you're just, you know, spending wisely and not spending unnecessarily as well.
Mhm.
Yeah, great. All right, well, thanks everyone for the great questions that came in. I think we are at time. And so if you have additional questions or want to connect to a member of the Maven team, you can send us a message on our contact page, which is mavenclinic.com/contact. And Kate also mentioned our annual report. So if you're interested in getting more insights and benchmarking from your peers, you can go ahead and click the link that we're going to share in the chat to download the report. And just thank you. Thank you all so much for your participation and all the great questions. We were so happy you're able to join us today. And we really would love your feedback. So if you have a moment, please complete the survey that's going to appear when you close out your Zoom. And we would really appreciate any feedback that you share with us. So just thank you. Thank you to Kate and Danielle for joining us and sharing all of their insights and live stories. It's such great context for all of us. And just thank you all for being here, and have a great rest of your day.